Dear audience, good afternoon. I'd like to talk some minutes about my PhD thesis titled The Association Between Fluid Therapy and Organ Dysfunction in Critically Ill Patients. My name is Ildikó Szántó. I work as an anesthesiologist and intensivist in Nyíregyháza, and I'm a second-year PhD student. Now I have a vision to use optimal fluid therapy for every critically ill patient to achieve better clinical outcomes, and to achieve this, our mission is to improve fluid administration through research, education, and clinical practice changing. To achieve this, we have two specific goals now ongoing. Let's jump to the first, which is to investigating the effects of balanced crystalloids versus isotonic saline on organ dysfunction in patients undergoing major surgery when we use the methodology of systematic review and meta-analysis. Let's talk some words about the background. Using intravenous fluids is essential to stabilizing circulation, and for this is the first choice using crystalloids. There are two main types of these solutions, the balanced and unbalanced solutions. The second is the isotonic saline. The main difference between the two solutions is that the concentration of isotonic saline is about 50% higher than the concentration of blood or the balanced solution. That can cause an excessive chloride intake to the patient, and we know that these chloride can be harmful, causing some complications such as acid-base imbalance or arrhythmias. Why we use the postoperative patients or perioperative patients. It's a big patient population, about 230 million surgeries yearly, with a very relatively high complication rate. And till this point, we know that perioperative fluid therapy is essential, and we have some guidelines where the crystalloids suggested as a first choice, but we don't have enough evidence whether the balanced or unbalanced solutions are associated with better clinical outcomes. That's why was our aim to investigate this association between the two solutions. Our clinical question is perioperative fluid therapy with balanced electrolyte solution or more beneficial than isotonic saline in preventing postoperative complications. Our patients are patients undergoing major surgery. We compare the two solutions, and our primary outcome is the postoperative complication rate based on the Schwarzwälder article. We hypothesize that using a balanced crystalloid is superior to using isotonic saline to decrease or reduce postoperative complication rate. We conducted a systematic search on the 10th of November last year in the five main databases with this search key, and at the end of selection process, we found 29 eligible full texts. Let's jump to our results. This is the first figure, the most important for us. This shows the postoperative cardiovascular complications. In this case, that means that the patient, how many patients need vasopressor therapy in the perioperative or postoperative period. On the figure, you can see 7 randomized controlled trials, and at the overall risk ratio is 0.68, which means that those patients who get balanced electrolyte solution have 14% lower amount the vasopressor therapy. That is a relatively consistent finding because the heterogeneity is low, but the risk of bias is relatively high. Our second figure shows the so-called physiological background of these findings. It's a merged forest plot. It's a little bit letters, but the first part of the plot shows the chloride level changing under the operation. It's relatively logically resolved because the concentration of chloride is higher in isotonic saline, so the result is statistically significant. So in the group who get isotonic saline was the chloride level higher. Associated with, as I mentioned, that it can cause acid-base imbalance, the pH level was higher those who get isotonic saline. And the last part of the plot shows the third parameter, which is a compensatory mechanism of our body, the B's excess level. In this case, you can see that those patients who get balanced electrolyte solutions have much less negative B's excess level. So this three results together shows that using balanced electrolyte solution favors to maintain the acid-base balance under operation. The third figure shows almost the same with those that you see the intraoperative change in solutions. The left side you can see the intraoperative change, and the other side the degree of change. Both shows that using balanced electrolyte solution have a better impact of acid-base balance. The next figure shows that these differences not related to the amount of fluid because there is no significant or not significant difference with the two group how many fluid was taken under the perioperative period. So we can say that these changes related to the composite of the infusions. So we are now in the manuscript writing phase. We finished the introduction and the methods part, and we would like to accept our submission in this year, February. We have some strengths and limitations also. Our strength is the large number of patients, and in the last years it is the most comprehensive meta-analysis in this topic, but also we have heterogeneity of the population, and of course the perioperative and intraoperative intervention make heterogeneity also. So we can conclude that balanced crystalloids can reduce postoperative cardiovascular complications, which can an implication for practice that high cardiovascular patients the balanced electrolyte solution can be better, and our implication for research that further studies with homogeneous population would provide better evidence. And let's jump to the second topic, which we also systematic review and meta-analysis. We would like to investigate the same problem as earlier, but in another population in septic shock patients, because it's another very high number of patients, and despite of better treatment, the mortality rate is very high. And according to surviving sepsis guideline, we have a weak suggest for using balanced electrolyte solutions, but the evidence are insufficient how fluid type influences organ dysfunction. So we would like to investigate this difference. That's why our clinical question, does using balanced crystalloids decrease organ dysfunction compared to isotonic saline, where we format a PICO framework where the patients will be the septic shock patients. We compare the two mentioned solution, and our primary outcome would be the development of organ dysfunction based on the SOFA score. And we also hypothesize that using balanced crystalloids is superior to isotonic saline and associated with a decrease in organ dysfunction in these patients. And our clinical implication would be that using the most appropriate fluid can decrease the incidence of organ dysfunction. So summarize my aim, I would like to submit my paper in this February, and second at the end of this year. And I would like to close my presentation with the words of Mary Poppins: everything is possible, even the impossible. Thank you for your kind attention.
Congratulations for your nice presentation. My question would be that we know that not only the type of fluid but the amount is also very important, and you mentioned that there were no significant difference in the fluid amount given. It's not a surprise, but is there any data? What protocols did they use in their publications, or were there any other higher level hemodynamic monitoring?
Thanks for your question. Some cases so all cases using arterial line. That was the basic, and there were some investigation, especially some elective brain tumor operation where it was some kind of other hemodynamic monitorization, for example, non-invasive measuring of cardiac output on the patient's figure. I can't tell the original name, so some patients uses this, and there were some studies where used CVP and CVP monitoring to organize the amount of fluid. So, some patients still uses this. Yeah.
Thank you, Ildiko.
Thank you for your presentation. And my question is that for another type of fluid, the colloids, is there any indication for the new generations of colloids? Very intraoperative situations.
Thanks for your question. I can tell you that we haven't investigated this part of the story because we want to see the difference between the two types of crystalloids. So we don't want to compare, for example, apple and pear. So we want to compare two apples. And that's why I cannot tell you the exact answer. I think that it's only my opinion, and I can't tell that it's written any guidelines or anything, that mostly the first choice of intraoperative usage of colloids is bleeding, when you cannot take the blood pressure with crystalloids.
Actually, I have a connected question. In the second study, we are going to investigate septic shock patients. And in these patients, correct me if I'm wrong, but the purpose of the fluid resuscitation is to stabilize the hemodynamics.
Yes.
In simpler words, we are trying to maintain blood pressure and perfusion.
Yes.
Why do you think balanced electrolyte solutions would lead to better organ dysfunction scores in fluid resuscitation and septic shock patients? Isn't it all about the quantity of the fluid and not the quality of the fluid?
I think both is important. Based on this research, we can tell that perioperative patients, the amount of fluid seems not so important, just only the qualitative parameters of the fluid causes this. Firstly, the electrolyte changes, and after it, the cardiovascular or other clinical parameter changing. But I think in septic patients, where you give a very high amount of fluid, as you mentioned, for the resuscitation phase, it can make more higher this difference between the two fluids, and I think the later complications, not only for the treat with vasopressors, just for example the acute kidney injury or the mechanical ventilation days can be relevant in this case. That I think, and it's just also my thing, that these days will higher on those patients. And I would like to show it or to know it.